speaking with Kate Dodson, Vice President of Global Health at the United Nations Foundation. We're going to talk about the latest collaborations that they've set up with the WHO and other partners to raise awareness and funds for the COVID-19 response. And we think there's a lot to learn from their creative approach. Kate's joining us from her home outside of Boston, and we're going to jump right in. So let's talk about the work you're doing with WHO. What innovative ways are you engaging with partners? And what are you doing to raise awareness and mobilize resources right now?
Thanks so much for having me. Great to be with you all. And it's a great question because we are doing a lot to help WHO and other parts of the UN system advance their vital global public health work in the context of this COVID pandemic. The most central part of that work is launching what we're calling the COVID-19 Solidarity Response Fund, which we launched just 2.5 weeks ago as the foremost way for individuals, philanthropies, companies, organizations around the world to contribute directly to support the vital frontline response on this COVID pandemic. This fund has a lot of different dimensions. It's already been very well received. We've got over $112 million in firm commitments or monies received from over 220,000 different individuals, companies, and organizations. And first and foremost, it is a tool of global solidarity. I think that's the key part of our messaging, that we're all in this together. This disease is clearly not respecting borders and requires a global solidarity response in order to get in front of it and find solutions and pave our way through this. Individuals especially are really finding resonance with that message. Over 200,000 donations to the fund from individuals. That's well over $8 million. And the way that people are talking about why they're committed to this is because they see that value in global solidarity. If it's a person in Italy saying, this is a crisis in my own country, but I really need to make sure I'm a part of helping others who are less fortunate than I am. If it's someone who is, she's a woman in Ireland is doing a squat-a-thon. She's doing 4,000 squats to raise thousands of dollars for the fund because she's a personal trainer. She's stuck at home and she's finding motivation to get involved in something bigger than herself and in a way that she can engage globally in this. And so all those stories are why people are coming to the fund, and why we've created it is because people have felt that yearning to connect to something larger than themselves, connect to the global community, and the fund is a way for them to do that.
Okay, great. So how are you organizing all of the enthusiasm and deciding where to go and what to do? And do you want to talk a little bit about the Twitch TV initiative that happened?
Sure. So this is a really multidimensional fund and outreach strategy. We've got kind of a way for private companies and philanthropies to engage, and that's kind of more your traditional fundraising. But the real exciting and innovative way is engaging the online influencer community, celebrities and other people who have influence and are really also keen to engage in this as well. And they have large audiences and large reach. And those pieces of this puzzle are really starting to pick up in pace. Last week, we partnered with Twitch TV, an online gaming, kind of the ESPN of the gaming world, for those who are not as familiar with the gaming world. And they stood up and said, listen, we have an audience of millions who are globally dispersed, who really want to get involved in something. And so Twitch set up a 12-hour Stream Aid. It was, a virtual concert series with artists from around the world connecting via their own Skype or Zoom platform to share, songs. We had other influencers sharing their moments, their expertise with the Twitch community. And we used it as kind of an online telethon. We had more than $2.7 million raised from people around the world. The average gift was quite small, which just showed that, kind of regardless of ability to give, people are finding the motivation to do so. We have lots of future opportunities for that kind of wide public mobilization and opportunity coming up in the next handful of weeks, which we're really excited about as well. And there are other ways too that we're using these huge platforms, these reaches of celebrities and other influencers, platforms like Twitch, and other partners like Facebook who have stepped up, where we're not only asking for donations to the fund, that's actually often the last ask. The first ones are really about what you can do as an everyday citizen to be responsible and a good steward in your community in the context of this pandemic. It's things we know well, evidence-based information about the essential importance of hand washing, about social and physical distancing as a way to make sure that we're curbing the spread and we're each doing our part. It's about mental health and well-being and trying to find ways to stay connected and be a part of this global community. So those are the three primary asks that we're going out with these key partners that have reach and influence, in addition to trying to help steward some funds to support the vital work of WHO and its partners on the front line.
Yeah, I mean, I think the Twitch TV example is amazing because it was offering entertainment to people who were supposed to stay at home.
Mm-hmm.
And then I tuned in whenever there were some of the soccer players, playing the video game soccer. And then you had the added, fundraising element. Is very smart. I think it'll be interesting, to touch base with you again as we're able to reflect on what has worked in bringing the global community together, and maybe how that can continue beyond a global pandemic. Motivating people around more than just public health and maybe other issues.
That's part of what we've been doing with this fund all along the last few weeks we're building an airplane while we're taking it off down the runway. And there will be undoubtedly a lot of lessons to be harvested in ways that we will need to make sure that we're maximizing this kind of short-term imperative and urgency and connection points with long-term ability to engage key and new audiences in these really important health messages.
Great. So what are you seeing as the current gaps and anticipated challenges in this specific COVID-19 response as you're proceeding?
Well, one piece that we're keenly focused on is to make sure that this fund in particular is really feeling like a global movement, that there are people regardless of where they live, regardless, frankly, of the way that their country or their community is personally affected, that they can find a way to connect with each other and with these larger public health messages that are so important, as well as find ways to connect and find relevance with the fund. So extending the geographic reach is a key priority for us, and making sure that we are using and stewarding the funds that we are raising to reach the most vulnerable communities at the front line, to address the kind of multidimensional public health nature of this crisis. So for instance, it's not just we have to both reach most vulnerable communities and also accelerate the R&D agenda for a novel vaccine. And so that's, I think, the next chapter of the fund is how we can ensure that not only are we maximizing the reach and the ability of the fund itself, but also adequately working with partners, especially WHO, to steward the resources to most highest use needs.
So we're thinking our audience is a lot of people who are working in the development community, NGOs, advocates, communicators. What sort of advice do you have for them in this rapidly changing landscape in terms of proceeding with their messaging, but also in this context of COVID-19 and basically how do they wrap their heads around that and do the best that they can?
Well, first I'll answer it by saying we're in that boat as well, because the UN Foundation does a lot of advocacy and outreach on a range of different health issues. UHC, universal health coverage, and the primacy of primary health care is essential to that message. But we do work on vaccine advocacy, on maternal newborn child health advocacy, on malaria advocacy, and we're trying to rapidly innovate ourselves. And so I think, first of all, we're learning lessons from each other and finding ways that different communities of advocates are working together in new ways to innovate together and make sure that messages that are developed are integrated and are coherent amongst each different community. But then I think not giving up on the importance of some of these messages in this context and some of this advocacy in this context. Women are still going to be delivering babies in the course of the pandemic, and they have every right, as they have ever, to deliver safely with attended birth. And those newborns have every right to receive the care that they need to help them survive their first 30 days and beyond. So we can't give up the importance of that messaging in this context, in spite of COVID. But I do think we need to be mindful of how we can, especially while this pandemic rages, recognize putting the kind of key essential nature of putting frontline health workers in the center, that they are well supported to do not only their vital COVID work, but also their vital work in helping deliver safe babies and all the rest. We've got to make sure that we're thinking about and elevating the urgency of the backbone of essential primary care and universal health coverage, even while COVID rages. I think we also can't get rid of the long game that we're all committed to. The reason why this pandemic is so concerning in so many settings is because we don't have, full universal health coverage in every country of the world. We don't have adequate preparedness for global health threats in every country of the world. And we need to make sure that we're not sacrificing that long view in our advocacy, as we're also trying to attend to the vital survival needs of the key populations that we all care about so deeply.
Okay, great. Thank you so much. Is there anything else? And we'd love to be able to touch back base with you and see how things are going in the coming weeks and months, as we know this is more of a marathon than a sprint.
It is both a marathon and a sprint,
Yeah.
and I think that's what I've been using a lot, and how I'm trying to think about it is that we have to both be sprinting right now to the extent that we can, to the extent that the circumstances allow, but keep in mind that there's a marathon going as well. But thanks for having me. It's been this Every Woman, Every Child community is one that the UN Foundation has been involved with deeply over its entire tenure, and we care so much about this community and the work that everyone is doing through it. So thanks for having me.
Thank you so much.